Today I'm here at the Faith Regional Physician Services Pain Management. I had the opportunity to speak to one of Faith Regional's newest doctors, Dr. Robert Prince. He specializes in a technique that's being done here in Norfolk. In fact, only 3 doctors in the state of Nebraska do this technique.
A lot of times we see patients who have fairly specific nerve injuries that are actually causing all of their pain. For example, a patient might get a hernia repair, and the hernia repair goes very well. The problem is that when the surgeon did the procedure, the nerves got inadvertently injured. Not through any fault of the surgeon, it's just one of those known complications. So now the hernia is fixed, but the nerve is still firing. It's still sending pain signals to the brain. And it can be very uncomfortable, typically in very young patients. And they can try pain medications, but a lot of times they're not very effective. They make them sleepy. And so this technology sort of addresses that kind of problem where there's a specific nerve injury. Another example would be a crushed ankle. They fix the ankle, but a lot of nerves were damaged, and so the ankle continues to hurt even years later. Or people will have arthritis in their knee. They'll get their knee replaced, but again, the pain continues in the knee, probably because of nerve damage done in the process of replacing the knee. Even though it's done correctly, it's just inevitable when you cut through things, like surgeons have to, that nerves are going to be injured. And in most people, those nerves either heal or they don't keep firing. But in some people, they continue to hurt. So basically what's happening when an injured nerve is conducting pain to the brain is it's using electricity. That's the medium of communication to the brain. And so what we try to do, what the technology involves, is using a small electrical signal near where the cell bodies are for those nerves to basically turn them off. It's sort of fighting fire with fire. And we've used this technology in other ways for other things, but we've never been very successful when individual nerves are causing the problem. And the new technology allows us to put the wire much closer to the problem than we've ever been to before. The device is placed similarly to an epidural placed for women in labor. There, a catheter is placed and local anesthetic is placed through it to numb so that labor doesn't hurt. Here it's a little different. We do place a catheter similarly, but we take it all the way out the foramen to the nerve root that's causing the problem. And then through that catheter, we're able to place a wire that has a number of leads on it. They lie right next to the nerve root, and they generate a little electricity which can block the pain of that nerve root from reaching your brain. Assuming the testing is successful, the wire is delivered to the battery under the skin. A small incision is made below the underwear line, and the battery is placed, and it will typically last about 5 years before it needs to be replaced. The device is controlled by something that looks quite a lot like a cell phone. In fact, it's made by Apple. And this way the patients can increase or decrease the intensity without being particularly conspicuous. I would say that something like this is very new. The great majority of people that could benefit from this clearly have not even had the technology tested. So I'd say in that regard, it's very new. The concept of using electricity to kill pain is a very old one. But the older technologies that tried to accomplish what this accomplishes were unsuccessful for these kinds of injuries. And this is successful. So it's sort of a building on of previous technology.
If you have any questions, contact Faith Regional Physician Services Pain Management.